To our show, Health and Wellness, Myths and Facts. Now, made up of the glands that produce hormones, the endocrine system regulates almost everything that happens in the body, controlling growth, puberty, processing food and water, and maintaining the proper levels of blood sugar. The pituitary gland is the master gland controlling all the hormones in the body. If the gland goes wrong, then people can suffer from a range of symptoms as well as conditions. These are rare and can be tricky to diagnose, so more awareness is needed to promote quicker diagnosis and better care. Now, in addition to outward physical changes caused by some pituitary disorders, other symptoms directly and indirectly affect not only the patient but their family and other relationships as well. It has been documented that clinical depression and anxiety are common with pituitary disorders, and pituitary diseases are rare conditions with severe chronic multi-organ and multi-systemic morbidity requiring complex multidisciplinary treatment and usually lifelong drug treatment. Pituitary disorders are the most unseen disorders where people struggle with in daily life. We have invited eminent endocrinologists to provide medically accurate advice on preventing various endocrine conditions related to the pituitary gland and help our viewers identify long-term control strategies. On the show today, we have with us Dr. Sajal Kamath, consultant diabetologist and endocrinologist at the Sahyadri Hospital in Pune. Also with us, Dr. Akhila Bhandarkar P, a consultant endocrinologist at the K.S. Hegde Medical Academy in Mangalore, and Dr. Sanjay Saran joining us, the Associate Professor, Department of Endocrinology at SMS Medical College in Jaipur. Thank you so much, doctors, for joining us on the show today. Now, hormones influence the health of our bodies and minds every single day. Dr. Bhandarkar, why are hormones so essential to bodily functions in life?
Good afternoon, everyone. So these hormones, they are the tiny little messengers actually. So they are released from our endocrine glands that are located in various parts of our body. So once released from these endocrine glands, they travel via blood to various target sites where they do major actions. So to name the endocrine glands which are located, so starting from the top, at the level of brain we have pituitary, which is going to be the major topic of discussion for today. And then we have at the level of neck, the thyroid gland, which I suppose is the most popular gland. And then in the abdomen, we have pancreas. And then above the kidney, we have adrenals. And then in the pelvis, we have reproductive organs. That's in males, we have testis, and in females, we have ovary. So once these tiny little hormones are released, they have major actions. So to name some of them, which has already been told by you. So starting from the birth, it is very important for the growth, and then later on for puberty. And then it maintains various cycles of our body, like it's important for sleep-wake cycle maintenance, it's important for menstrual cycle, it's important for appetite and weight regulation. It's very important to regulate the blood glucose and blood pressure, as well as various electrolytes like sodium, potassium, so all of them. So the regulation of all of them are controlled by these tiny little hormones, which play a huge role in our human body. Thank you.
So it's clear that hormones are integral to our digestive, immune, urinary, reproductive, as well as our nervous system, as Doctor just made it clear. I'd like to take my next question to Dr. Kamath. Doc, how is the secretion of hormones controlled and managed by the body? And what role does the pituitary gland play in the control of hormone secretion?
Hi, good afternoon, everyone. So as Dr. Akhila mentioned, that these hormones are these tiny little messengers or tiny little chemicals that are secreted by multiple glands in our body. So basically the control of it is regulated by or managed by something called as a negative feedback or a positive feedback. Mainly it is the negative feedback. So a lot of these glands secrete certain hormones, and these send the messages to something called as the master gland or the pituitary, which we are discussing mainly about today. So this master gland then releases certain hormones that viciously regulates the hormone secretions in the body. So what this pituitary gland does, so what role does pituitary gland have, is it secretes certain hormones, for example, thyroid stimulating hormone, say adrenocortical stimulating hormone. So as Dr. Akhila mentioned about the various glands secreting various hormones, so the pituitary is the one, or the master gland is the one regulating the secretion of these hormones by various glands through something called as a negative feedback. Also, in addition to pituitary, there is another part in the brain called as hypothalamus, which also partly controls the secretion of these hormones, and it becomes something called as a hypothalamo-pituitary gland-related axis. So this is how hormones are secreted in the body, and this is how pituitary gland controls it. Thank you.
Right, Dr. Kamath. The main function of your pituitary gland is to produce and release several hormones, as Dr. Kamath has just explained, that helps you carry out important bodily functions. Now, the next question I'd like to take to Dr. Saran. Doc, how are pituitary disorders diagnosed, and can a blood test detect pituitary problems?
Yeah, we know the pituitary is the master gland of the body. So mainly if the pituitary gland is affected, then we can see other glands are also affected, because the master gland, it controls the other glands also. So as far as tests are concerned for the pituitary gland, we usually do the test in the blood. We separate the serum. In the serum, we see the hormones level. So first test to be done are the serum hormones level. Then again, later on, depending on the situation, we do some dynamic testing. So dynamic testing, particularly we are doing for the growth hormones, we are doing for the other hormones like FSH, LH. So depending on the situation of the patients, so whether we need some dynamic testing or we need some suppression testing, we need to stimulate the hormone, pituitary hormone, to see the maximum level of the pituitary hormone, or we need to suppress the pituitary hormone to see the minimum level of the hormones. Depending on those conditions, depending on the disease, we do this kind of testing. So first, we do the testing of the hormones inside the blood, in the serum. Then later on, once the disease is diagnosis is made that this may be the disease, then later on we go for the imaging study of the pituitary gland. So which hormone is affected, accordingly that we do the imaging study of the pituitary gland, or concerned gland also we need to do the imaging study. Sometimes as the pituitary controls the this thyroid hormones, or we need pituitary controls the adrenal glands also. At that time, once the secretion of the pituitary gland is more, like the ACTH hormone which controls the adrenal gland, secretion of the ACTH is more from the pituitary, that causes the hypertrophy of the adrenal gland also. So then again lead to cortisol, hypercortisol secretion. So likely we do the imaging. First we do the blood test, then later on we do the imaging to diagnose the particular cause of the this particular disease.
Right. Dr. Akhila Bhandarkar, if you could just explain to our viewers, what is acromegaly and what causes acromegaly?
Yes. So the word acromegaly, it's coming from a Greek language. So acro means extremities, and megaly means enlargement. So as the name suggests, what is visible in this condition is enlarged hands and feet. So how does it happen is that it's because of the growth hormone excess. The growth hormone is one of the major hormones which comes from pituitary. So as the name suggests, growth hormone is very important for growth of our entire body. So most importantly, what we see in acromegaly is the growth of the bones. So these patients usually present with enlargement of the skull bone. So they may complain of increase in the head size, or the enlargement of facial bones. So that may present with say enlarged or protruded jaw and malocclusion. So apart from that, there can be a complaint of increase in the ring size. So previously a ring which used to fit in, so now it's not fitting. That could be one of the complaints, and also increase in the shoe size. So all this happen because of the growth hormone excess from the pituitary, which is stimulating all these bones to grow. So not just the enlargement of bones, but it also has metabolic implications. Like these patients also tend to have diabetes, high blood pressure. They can also have reproductive issues like infertility, and also other bone health issues, say like arthritis or pain in the joints. So these could be the major complaints in acromegaly.
Right. So as Dr. Bhandarkar has explained, acromegaly is a rare but serious medical condition that happens when you have too much growth hormone in your body. Now, Dr. Kamath, I'd just like to bring you in. Why does acromegaly cause vision loss and headaches?
So acromegaly does cause headaches. So most of the symptoms, as Dr. Akhila has also stated, are mainly because of the growth hormone excess. Also, because acromegaly is usually due to a pituitary tumor, and if the tumor is bigger in size, it may compress the adjacent tissues, adjacent nerves, and this would lead to cause headache or visual disturbances. So if the tumor enlarges and there is a surrounding structure known as a cavernous sinus, if this structure gets involved, it contains a nerve known as a trigeminal nerve, which is responsible for the pain. So if this gets compressed, that is what causes the headache. The other part of the brain that can be compressed because of the tumor is the dural lining. So dural lining is the lining of the brain which is sensitive to pain. So if this structure gets compressed, that can also lead to headaches. Coming to visual loss again occurs if the tumor enlarges in the upper area, or superiorly as we call it. The optic chiasma, or the interface of optic nerves, gets involved. Optic nerve is the nerve which is responsible for your vision. So if that gets involved or that gets compressed, that could also lead to visual loss. In this case, peculiarly, your central vision is mainly preserved, whereas your peripheral vision is lost. So you could be able to see the center aspect, but your peripheral vision goes away. And this is how headaches and visual loss occur due to acromegaly.
Right, Dr. Kamath, thank you so much for explaining that with such clarity. Dr. Saran, is surgery a cure for acromegaly, and what drugs are used to treat this?
Yeah, for the acromegaly, the treatment of choice is surgery, because in most of the cases, acromegaly, it is caused by the pituitary tumor. It can be microadenoma or it can be macroadenoma. Usually it is macroadenoma because disease is very indolent, is diagnosed later on in the life. It may take 5 to 10 years to diagnose the disease once disease has started. So usually at the time of diagnosis, it is macroadenoma in the pituitary gland. Sometimes it can be there because of the other causes, hypertrophy of the pituitary gland, or because of some other secreting factor which causes increase in the GHRS release. Maybe in some other lung cancer or like other tumors, it can be there. So the main treatment is surgery. We know in acromegaly, the goal of our treatment is to normalize the growth hormone level, normalize the IGF-1 level, then resolution of all the symptoms of the acromegaly, which are because of the this growth hormone secretion, and also quality of life should be better in the acromegaly. So the surgery is the treatment. First we do the surgery. Once the surgery is done, then later on, maybe sometimes that we can, some tumor is left because of the stick to the blood vessels of some nervous pathways. So at that time, we need radiotherapy after surgery. So we do the radiotherapy, and in between radiotherapy and surgery, we require some medications to bridging therapy. So at that time, we can use some medications like dopamine agonists like cabergoline, or we can use some somatostatin releasing analog like octreotide, long-acting octreotide like lenalidomide or laroctreotide. We can use such kind of drugs. One drug is also there, that is pituitary. So that blocks the growth hormone receptor. So IGF-1, which is, as we know, the growth hormone causes release of and formation of IGF-1. That causes all the symptoms of acromegaly. So at that time, we can use this pituitary. So it blocks the generation of the IGF-1. So symptoms of acromegaly are relieved, but in this therapy, we can see the enlargement in the tumor size that can be there, but is not very significantly. So this is the treatment of acromegaly. For surgery, then later on radiotherapy. In during between bridging therapy, we can use some drugs. Directly drugs we cannot use.
Right. As Dr. Sanjay Saran has explained, The most common treatments for acromegaly are surgery, medication, and radiation therapy. With that, we're stepping into a very short break. Back in a moment with much more. Do stay with us. We have with us endocrinologists on the show to provide medically accurate advice on preventing various endocrine conditions related to the pituitary gland and help our viewers identify long-term control strategies. Dr. Bhandarkar, how does the pituitary gland affect the reproductive system? If you could just break that down for us.
Yeah, sure. Pituitary produces this fertility regulating hormones or peptides, namely FSH, which is otherwise called follicle stimulating hormone, or LH, which is luteinizing hormone. So these two peptides, they come all the way from pituitary, travel via blood to the reproductive organs. So in males, there is testis, and in females, there's ovary. So they come from the pituitary and stimulate these reproductive organs. So the secretion of this FSH and LH starts way early actually, but that's more evident around the pubertal age group. So these hormones, what do they do to the reproductive organs is that in males, as they stimulate the testis via the receptors, it leads to enlargement of the testis, and that's because of increase in the sperm production. And not just the sperm production, it also leads to production of the major male hormone, which is testosterone. And we know how important testosterone is for males, in that it controls all the, the male, maybe the hair production or maybe the sperm production also partly, as well as in future the reproduction. So apart from that, in females, these hormones, as they stimulate the ovary via the receptors again, so there it leads to production of what is called follicles. So it leads to growth of these follicles later on, which becomes egg or the ova. So these eggs or the ovas are released every month, okay, once she attains a menarche, and that's how the menstrual cycles also regularly happen. So not just the release of the eggs or the ova, but also the production of the most important female hormone, which is estrogen or estradiol. So because the pituitary regulates these hormone production both in males and females, as well as the production of the sperms in males and eggs or the ova in females, it becomes very important in the reproductive system.
Dr. Bhandarkar, thank you so much for providing us clarity on that matter. Dr. Kamath, now how does oxytocin affect brain development?
Yeah, so oxytocin is one of the hormones which is produced by the posterior part of the pituitary. So this oxytocin is called as the bonding hormone. So basically in the early brain development, oxytocin helps in developing the neural circuits, and that is how the brain development by oxytocin is stimulated. So how is this important, or what aspects of your brain development does oxytocin help with? So oxytocin, as I said, is a bonding hormone. So it usually modulates the social processes or the behavioral processes in the brain. So it affects different aspects of social behavior, mentalization, bonding, etc. And that is why it is known as the bonding hormone. So the social differences or the behavioral differences are related or to the oxytocin, or are caused by the oxytocin hormone or the bonding hormone that is released by the posterior part of the pituitary.
Right, so as Dr. Kamath has explained, oxytocin can induce anti-stress-like effects such as reduction of blood pressure and cortisol levels. It also promotes growth and healing. Dr. Saran, how do the thyroid and pituitary work together towards the growth of a human being?
Yeah, as the growth of the human being is very well orchestrated with the glands like thyroid and pituitary. So if we consider regarding these two glands, pituitary gland secretes the growth hormone, but actually that have the roles of the these human beings only after 2 years of the age. So before that, actually the main hormone is thyroid hormones, which works on the growth plate to causes the growth. So it is having the two roles. First thing, the thyroid hormones works on the growth plate of the bones. So they causes the bone to grow, first thing. Second thing, they have the permissive role for the growth hormone. So without the thyroid hormone, growth hormone secretion will be very less. Secretion is lesser. So again, there will be lower generation of the IGF-1. So we know the IGF-1 also causes the growth. So lower generation of the IGF-1, again, the growth will be stunted. So mainly we see many of the patients who are having thyroid hormone deficiency, that is severe deficiency is known as cretinism. So in those kids, we see kids are very small in height. So we can say the height is very less, they're very short. And the other effect of thyroid hormones are also deficient in those kids. But as far as the treatment is concerned, once we are starting the treatment with thyroid hormones, again they grow. But depending on the condition of these kids, when to start the treatment, how long should the treatment started, at what age. So accordingly that. So again, the thyroid hormones are also having roles in the fusion of the epiphyseal fusion. So again, the growth will be stunted if the thyroid hormones are given at the time of puberty, like that. So situation is very tricky depending on the condition of the patients, when to give the thyroid hormone in case of thyroid deficiency, or the growth hormone. Obviously, they works only when the thyroid hormone is present.
Thank you so much, Dr. Saran, for explaining that to us. Dr. Akhila Bhandarkar, what are the non-cardiovascular complications of hypopituitarism?
Yeah, so in medical language, when we say hypo, whenever we use the term hypo, we basically mean that the functioning of that particular gland or that particular organ is less, or it's deficient. So the term hypopituitarism can explain on its own that the pituitary function is reduced, or maybe it's absent also sometimes. So we've already seen how important pituitary is, and there's so many hormones which come out of pituitary. So what would happen if there is hypopituitarism? Sometimes it could be as as bad as some life-threatening complication, but sometimes it can get picked up quite early. So let's take the axis one by one. So the first and the most important axis I would tell is about the cortisol axis. So cortisol is one of the major steroid hormone which is required for normal human body function. That's a physiology of the body to be maintained. So this cortisol comes from the adrenal gland once the ACTH from the pituitary stimulates the adrenal gland. And that's how it's released from the adrenals. So if there's a lack of cortisol, as what happens in hypopituitarism, then the patients can have something called as adrenal crisis. So that can present with a drastic loss of weight, and there can be sudden loss of drop in the blood pressure. There can be a drop in blood glucose, and there can be electrolyte imbalance. The patients can present with severe GI symptoms like nausea, vomiting. So this can be definitely life-threatening, and luckily we have a very good, we can manage it very well with medications also. So there's nothing to worry as long as it's picked up early. So coming to the second axis, that's the thyroid. As Dr. Sanjay Saran sir has already explained, the TSH that comes from the pituitary, that's the peptide which comes and stimulates the thyroid gland. So if the deficiency of this TSH happens, then the patients will have hypothyroidism of central origin.
Right.
So that is already explained. And the third one is what I've spoken before, that's on the reproductive axis. That is the lack of FSH and LH. So if there's a deficiency of this, then the patient will face problems with respect to reproduction like infertility or premature menopause. And then the last one is the antidiuretic hormone, or what we call as ADH. So that plays a very important role in maintaining the water balance in humans. So if there's a lack of this hormone, then the patient can have a lot of urination, what we call as polyuria. So they tend to lose a lot of water, and there can be a drop in blood pressure if that proceeds. And there can be a elevation or increase in the sodium, presenting as severe hypernatremia in some cases.
Lots to unpack there, but thank you, doctors, for all the advice on preventing various endocrine conditions which are related to the pituitary gland and helping our viewers identify long-term control strategies. Thank you all for investing your time in watching. Goodbye.